Hello, I'm Dr. Steve Ballou and I teach family medicine at the University of Ottawa in Canada. I'd like to teach you something important about taking a medical history, and that is the complete review of systems. There are many, many questions that you can ask a patient, far too many to remember. So what I would like to do is give you a simple map that will guide you in your questioning. The map is your own body. It's easy to remember. You start at the top and you work down. But before you start at the top, you look at the person overall. How are they doing? You can ask them, are they sleeping well? Are they eating well? Has their weight changed? Then you can start at the top with the head. Do you have headaches? With the eyes? Do you have any problems with your eyes, or do you have any problems with your vision? With the ears? Do you have any problems with your ears? And how is your hearing? With the mouth, you can ask about how are their teeth? Are they having any problems with swallowing? Working your way down, you have the chest. You can ask, do they have any problems with their breathing? Do they have any sputum? And then, of course, besides the lungs, there's the heart. Do they have any chest pain? Do they have any palpitations? Moving down, we have the abdomen. So you can ask, do they have any heartburn? Do they have any pain when they eat? And then, of course, intestines. Do they have any problem with their stool? Are they constipated, or do they have diarrhea? And very important, you should ask, do they ever have blood in their stool? And even more important, you should ask, do they ever have blood on the toilet paper? Because people generally see these as two different things. But you know as a doctor that they mean the same thing. It's not normal to have blood either in the stool or on the toilet paper. Below the abdomen is your bladder, and so you can ask about their urine. Do they have any problems urinating? Do they have any burning when they urinate? Is there ever any blood in their urine? And of course, below that are the sexual organs. And a very good question is, how are things in bed? If people want to talk about their sexual life, they will. If they don't, they won't. It's important to ask. For women in particular, you might want to ask about their menstrual periods, how often and how long, how heavy is the bleeding, do they have any pain? And for a man, you might want to ask, do they have any problem getting an erection and keeping it when they have intercourse? Moving out to the limbs, we'll ask about musculoskeletal problems. Do people have any pain in their joints? Do they have any swelling? Do they have any stiffness? Do they have any back pain? And we finish off with the skin. Do they have any rashes? Do they have any spots in their bodies that have changed? Do they have any wounds that are not healing? And do they have any lumps or bumps? And I'd like to finish off with questions about the emotional state of the patient. Are they anxious? Do they have any problems sleeping? Are they depressed? So that's the map. It's your own body. You start with the general appearance of the patient. You work from the head down, and you finish off with questions about their emotional state. And on your way, if you find something important, then you can ask more questions that are pointed in that direction. But with this map, you won't get lost. Thank you.